trip. And if you don't know, Messy Conversations is an initiative that Antioch University's undergraduate studies program started a little over 4 years ago in response to the killing of George Floyd. And we wanted a place for the Antioch community to come together to be in conversation about race, racism, and anti-racism, and to challenge ourselves to more fully live up to our mission as an anti-racist institution. So we're glad to have you here today. I'm going to hand off shortly to Clarence Williams, who has gathered a very esteemed panel that will soon be introduced to discuss or to be in conversation about racism as a public health issue. Next week will be our final messy conversation for the fall quarter. And Pia Alexander, Stephanie Helms Pickett will be joining us to talk about some exciting news and an important effort underway to bring a NAACP chartered chapter to Antioch, Los Angeles. So we hope to see you back next week for that very important messy with our good friends Pia and Stephanie. Um, Remind you to remain on mute until you're called to join the conversation. And if you want in the conversation, please put your questions or comments or just say, hey, I want in on the conversation. Put that in the chat. CN will be monitoring the chat, and about halfway through our time together, we'll begin to call on you to join the conversation. So again, thanks for being here. And with that, I hand off to you, Clarence.
There is a bomb in Gilead. 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 Oh, Jesus is a bomb in Gilead.
Well, yes, I am Clarence R. Williams, and I welcome all of you again to Messy Conversations. We have indeed assembled a powerful panel today. And in this moment, I don't know if you guys have been paying attention, but with the recent election, there's been an echo of pundits and influencers and news anchors all declaring the results of the election rooted in racism and misogynism. So whether that's true or not, the debate continues. But today we're talking about racism as a public health issue. And I'd like to introduce briefly our panel. I invite you to go to the LibGuide to read more in depth their resumes, which are quite extensive. They're all extremely storied resumes and bios. And we are so proud to have this group of women in this moment to talk about this very important issue. I'd first like to introduce you to Ajala Jones. She is with us here locally in Los Angeles. She's one of the officers of the Los Angeles Department of Public Health. She's chief of the Birth Equity Unit. She directs several initiatives and programs on infant and maternal mortality, as well as preventative programs. And I would say most of her work is centered on children, adolescents, and of course, maternal care. Next, I'd like to introduce you to Grizel Howard. Grizel Howard is the co-founder and chief of the ATIRTE AirTech. It's a health solution company. She's also the owner of a private consultancy company. She's held many health initiatives, and she's currently serving as the chairman of the board of the Black AIDS Institute, and she's the interim managing director of the Black AIDS Institute as well. I'd also like to introduce you to our fan favorite go-to person on women's reductive health, Jan Robinson Flint. Jan has been on with us on a couple of other messy conversations, always keeping it messy, but always keeping it real. She is indeed the executive director of the Black Women's for Wellness organization, located here in almost in Washington, D.C., but we are here in Los Angeles, California. Jan, she focuses on a lot of women's issues. She serves many national as well as international boards. And she has a weekly radio show, which I did not know about until I got this new bio of hers. She has a weekly radio show called Some of Us Are Brave. And it airs on Thursdays at 2 p.m. on Pacifica Station 90.7 FM. So I'm going to have to check in this Thursday to check that out. But welcome, panelists.
Ooh, those some big shoes you asking me to fill. A fan favorite? Where did that come from?
Listen,
Good
you
googly
become more than
look.
twice your fan favorite. We'll try to give you a medallion the next time you come, but right now, we just got air for you.
I don't need a medallion, and I will take some air because one never knows when one will need some air given the state of the world these days.
Well, that said, we'd
I
like
want
to
to update you on one little thing, though. I am no longer doing a radio program on KPFK. Some of Us Are Brave. I think Todd DeCesoy Moringa is doing that program now. However, Queen Ajala Jones and I are doing a podcast called I'm Just Saying, Two Black Women with Opinions.
And how do we access that?
It's on all the podcast networks, BuzzFeed, Apple, the rest of them.
Well, great. Thank you for that addition. I'm so happy. I can't wait. So anyway, going on forward, in 2021, just months after the COVID-19 pandemic was raging, the CDC declared racism as a public health issue. My question to the panel is, could you describe what that environment was, and especially you, Ajala, working in public health as an official, what led the CDC to make such a declaration? It was stunning, it was bold, and I'm sure it was shocking to a lot of populations.
Well, I mean, at the time, so you're talking 2021?
That was when the CDC initially made the declaration. We know it's been going on, or it's been thought of for
Mhm.
years, as Griselle said in our chat earlier, before that. But that's when they officially declared it such.
Well, I think there were a number of things that were happening. So we had experienced, George Floyd's murder, the murder of our young sister Breonna Taylor, while at home in bed, um, and so many other, Ahmaud Arbery, and I'm not exactly sure the date of his death, but we were still experiencing those um, murdering of Black folks unarmed, in public, or in public settings, or near to public settings, or being videoed, or things of that nature. And so one of the things is we were receiving all of these, and post George Floyd, we received all of these, I'm going to do different letters. That's what I call them. That I'm going to do different letters that came from numerous organizations and corporations, right? We're going to address racism and bias. But we were also seeing a number of counties, one of which, I think the first one in California, I'm not sure, I'm might be wrong, but San Bernardino, I think, was one of the counties that said they were going to acknowledge racism as a public health issue. We were also in the midst of the COVID-19 pandemic, and had been looking at the variances of, access to the vaccine. I know at one point when it was coming to the community, you had folks that were not a part of the community coming, getting in line, and folks knew they weren't a part of the community when they pulled up in their exotic cars and stuff, but they were trying to be the first in line to get the vaccination. At any rate, for us, we were already, thankfully, due to Dr. Ferrer mentioning this, and recognizing it, being one of the first public health leaders that I experienced at public health, saying that racism was one of the leading causes of Black infant mortality. We had already started our efforts and work by creating the African American Infant and Maternal Mortality Prevention Initiative. And so we were still going along doing the work, but we were seeing, and I think CDC was experiencing and seeing more and more how we need to really acknowledge it is a public health issue that impacts people's overall health and wellness. And for us, I mean, I think for those of us who are African American and our foremothers and fathers, as well as us, have experienced racism most times our entire life, it was well past due, and we were looking to see what else was going to come our way, especially since you had the anti-Asian hate crime that was created during the pandemic, but we've yet to have that, especially for Black folks. So I think that is some of what I would say we were experiencing, but for us, the work wasn't stopping, and we were still elevating, addressing racism, and looking at interventions and strategies to improve pregnancy and birthing outcomes, or to address reproductive health and justice for especially Black women, but and Black families, but people of color as well.
Ms. Howard, would you care to add to that, or Jan?
Absolutely. I concur, but I would submit to you two things. But allow me first to recognize your work, see. The Black AIDS Institute still holds the record for screening the most people in a 24 and a 48-hour purpose. And you shared the work that we've done, but you don't share that in my consulting firm, you have been a key contributor to Aging Gracefully, how Black women challenged by aging, and how caregiving is challenged, and how we screen 3,000 people in a day and a half in the South, where the disease of HIV and wellness is greatly burdened. So I would be remiss if I didn't give that back to you. And with that, two things. One, racism is the outcome. Medical negligence is the constant. If in fact Mother Nature did not want us all to thrive, we wouldn't have diversity in the entire ecosystem. We don't just have one bird, we don't just have one fish. Where we must start is at the beginning. People who are genetically melanated, and I don't use it in a revolutionary sense, but I use it in a relaxing way so that we can understand. Our eyes are different. The PSA is different. There are things that we must acknowledge and they must be taught in medical school. And as Ms. Jones said, the endemic of COVID, the endemic, not pandemic, the endemic of COVID was the ushering in of the opportunity to just call it de facto racism. I would submit to you, if we started teaching the beautiful genetic nuances in medical school, then we could shift perhaps from racism. But until we acknowledge them, it is actually racism. And there's so much sexism. At the Black AIDS Institute since 2021, we've adopted this. If Black people in America are well, the world would be well. Why? We represent the most racial nuances of the genetics. What did COVID teach us? COVID said, if you present at a hospital and you don't have a fever, we will not admit you. Just like HIV, there was a lot of fear and unknowns. COVID is the great grandmother of HIV. Why? We know how you can contract HIV. We don't know how you can contract COVID. People will drop soup on the porch if you have COVID. People won't give you a glass of water if you have HIV. So in an instant, stigma was vanished. HIV, Black people are still burdened because we're still struggling with shame and stigma. So COVID has been very, very, very good to us if we know how to use it. And I would say this to you. The racism came in when the medical system forgot Black people. We take the largest amount of diabetes medicine. We take the largest amount of hypertension medicine. What are both of those? Anti-inflammatory. So if you're on an anti-inflammatory, the last thing you will have is a fever. So to make the fever the threshold to be admitted for COVID in a hospital, that's why we all went home and died. Wasn't that we're the sickest on the planet because you drive a bus or clean a toilet? My mother was a healthcare pioneer. Everything she did in the hospital, see, she had a saying. Loretta Jones kept up with Mom all the time she was in LA. I can do anything but operate. That means our wellness depends on our thought. You don't have to have a sheepskin to be well. Go back to mother wit. So Miss Jones is absolutely right. If in fact we don't address the brilliance of Mother Nature and our genetic nuances and start dealing with not only the medical aspects, but the messenger matters, stop politicizing funding, and look at the populace as true. Latino women influence their home and their health. Black women, we've been the wet nurse for the planet. We are the moral majority. We heal the planet. Yet, we're the last thought about. The numbers are clear. A Black woman presents, same socioeconomic education background, same neighborhood. Her counterparts will receive pain relief, will receive additional attention, will receive an expert consult, and I can come in there with the biggest belly and can't even think. And they'll say, oh, sit down and breathe. Infant mortality is the threshold, Cuba. We have, 47, right, Doc? 47 on infant mortality in the country. If the babies are sick, where are we? I just got very lucky. And the brilliant woman, Dr. Yvonne Maddox, believed in me. That's what gave me the confidence to do HIV. So being the architect of the Black Back to Sleep campaign, which was held in Los Angeles first. The Back to Sleep campaign was taking scientific information and distilling it down so that Black women and community could say, these are 6 things we know you can do so that your baby doesn't die in the first year of birth. We can do that all over again. I'm not diminishing a physician's role, but I am saying wellness depends on the whole community. And if we don't address that, then it's racism. So we have an opportunity. Heal the people. The largest spend in America right now is on prostate cancer. So misogyny shows up in a lot of ways.
I can
Jam,
jump
would you
in
like to
here.
add?
Yeah, I can jump in here. I feel like our lives now are kind of like we have these significant milestones, and COVID in that year 2020 is one of those significant milestones. It's like stuff that happened pre-COVID and stuff that is happening since COVID, right? And looking at how COVID highlighted and spotlighted racism in the United States, and white supremacy in the world in that regard. So I want to remind people when we talk about racism or misogyny or sexism or something like that, we are talking about people. Systems are run by people, right? So if there's racism in the healthcare system, that means there are racists in the healthcare system, right? And it means that the folks who went to medical school or whatever school they went to get whatever license they get to practice, right? Whether they're a nurse practitioner, etc., went to a racist school where they learned racist ideologies like Black women can take pain. And then they come and they create and perpetuate those systems, right, of racism and sexism and so on. I think two of the highlights that we all like to get, right, is the incidents of Serena Williams and Beyonce. And these women have all the resources they need. And yet the hospital staff treated them with indifference and treated them like Black women, right? So they had to save their own lives. And you will hear Serena Williams' husband said, if he hadn't intervened as a white man, that she still might have survived, might not have survived. He knew he had to intervene with his race privilege because of how they were treating his woman or his wife, despite the fact that she had enough money and still does to pay for all the interventions, all the medical procedures that are needed. Right? So this country has a system that perpetuates violence against Black folks, violence against Black women. And it was highlighted and spotlighted by COVID. How was it so in terms of if we look at how Black folks felt about vaccines, because we knew we had been experimented on and didn't want to be another grand experiment. How Black folks were feeling about treatment. Once again, this country has a history, excuse me, of treating us unequally and unfairly based on skin color. So when it came to how treatment was handed out, how vaccines was handed out, and they were like, why is it that Black folks are not running up to get this vaccine? Well, honey, this country has a history. And we have an adverse and negative relationship with the history of this country when it comes to accessing healthcare. So I wasn't running up. Let me let you get yours first and see what happens. And we saw even so what happened there were 3 vaccines, right? And the last one that came on board was Johnson & Johnson. And we found out that it had problems. So folks who had got the Moderna or the other one were like, ooh, right? Dodged that bullet. But the Johnson & Johnson was sold in our community as that one and done shot. And that's how people were like, okay, we'll just get one shot and we don't have to go back, because going back into a system that treats you poorly is a challenge in and of itself to healthcare. So we're like, we'll go once, we'll get this, we'll be done. So when we look at the data, the number of people who died, the number of people who were hospitalized, the number of people who were sick, then we saw that it had a pattern. And that's how we can determine, or that's how public health department determined, oh, we got a problem here. Because it was just so glaringly obvious during that time. And it was glaringly obvious even if you didn't look at maternal and infant health, even if you didn't look at HIV stats, even if you didn't look at sexually transmitted infections, even if you didn't look at heart disease, it was like, oh, we have a global pandemic and we're looking at how folks are dying in this country. And so many people died in this country. So that's how, public health began to recognize that they had a problem with racism because they have access to the data, but they are people. And they started looking at themselves in terms of the role that they played and how this was playing out. So, and I will say this, the CDC has had a series of meetings since COVID or 2020 to talk about what are we going to do with the next pandemic? Because y'all know it's another pandemic coming. And we all know it will not be 100 years, right? And it might even be accelerated given the new administration in terms of the people that they are putting in charge, because from my understanding, they put in Robert F. Kennedy, or they want to put in Robert F. Kennedy as the person who's the director of health service, and we all know he is anti-vaccine. So whatever is coming might be accelerated by the particular values, morals, and beliefs of the new administration that is coming in now. And those people, if they are in charge of our government, will absolutely accelerate and exasperate the racism that we experience on a daily basis.
I was happy to hear you talk about the delivery of the healthcare and how you need to go back to the actual, student level, to the med schools. Because with my personal work, with someone that you are well aware of, Dr. Loretta Jones, and Healthy African American Families, through that work that I was able to do with her, one of the things we've been doing as community academic, CAG members, we've gone to Charles Drew University, we've gone to UCLA, we've spoken to med students and tried to get them to understand what they should be looking at in terms of cultural competency and the way that they would deal with Black and Brown and BIPOC, populations. And so you're right, it needs to start there. But in your opinion, in the work that you've all been doing at this time since 2021, have you seen any amount of difference, of change, of initiatives happening to put forth any means of change, any kind of solution
I've seen
against
more
this
of the
problem?
same. I've seen more of the same, and I will tell you why. In terms of an example, Black Women for Wellness labored to help the University of California at San Francisco and California Department of Public Health put out a report called Centering Black Mothers. Centering Black Mothers looked at what they call the social determinants of health, looked at the impact and influence of racism and sexism on the maternal and infant mortality. And when I said labor, it took us 4 years, literally, to get that report out of them. And it was after they had not had a report on Black infant and maternal mortality for 30 years, 30 years. So with 4 years of labor, we get this report outlining how racism impacts us, outlining how these social determinants are driven by racism and sexism. And they released it very quietly on an August afternoon. No fanfare, no press conference, no tour, no briefings, nothing. They just put it on the website. That's how they released the report. 4 years later, this year, California now has an Office of the Surgeon General, and she releases what she calls a blueprint Black maternal health. Fanfare, meetings, etc. At no point in this blueprint does she mention racism. And at every point in this blueprint, it is let's blame the victim for the crime. Let's see how you can keep yourself from dying because, really is your fault. Really is you didn't go to the doctor enough. Really is you didn't follow instructions. Really, you didn't know, as opposed to how systems influence racism. That's more of the same. When we have data that says this is how racism impacts outcomes, and then the state publishes a report and does not blame systems at all, or does not implicate systems at all, and says, no, it's Black mothers' fault, and we're going to figure out how to solve this by making sure that they know all the stuff that they need to know. Nothing about the system.
What about you, Roselle, and your work?
In our work, we actually were the first organization to reach out to Tony Fauci, and it's on YouTube somewhere, early in the COVID endemic, and ask him to give the cascading order of risk for the Black community. He started out by saying, and this is key, everything we're doing in the COVID, we learned from the HIV community. I'll come back to Loretta. Participatory research is everything Jan has said, plus, if we could, she's absolutely right. Everything around racism, the public health model is broken. Currently, I have the privilege to actually know Mandy Cohen well. She came from North Carolina. I live in Charlotte, North Carolina. We ushered her in as the Secretary of Health to North Carolina, and I won't bore you with the concerns today. We'll catch up again. However, the participatory side, if we really start to focus on that, and we are doing that at BAI, and during COVID, we actually had a or intergenerational COVID committee. The youngest person was 15. The oldest person now, God rest her, was 90, Dr. Maxine Mims. She went on to be an ancestor 6 weeks ago. And these conversations were to empower the citizens. Fair? Here's what we first had as a benchmark. Know the fundamentals of the science. You don't have to go to medical school. COVID can never have a vaccine. It may have an inoculation, but if we were really empowered, you cannot have a vaccine for such a virus. Why? It constantly mutates. That's where we are today. But if we look at the entire system of healthcare at the time that COVID came along, and I'm not a conspiracy theory like RFK, U.S. government had 0 patents on pharma. We had 0 patents. To Jan's point, there were 3 quote-unquote vaccines. To this moment, we still don't know what the vaccine is or was, right? RNA, DNA. Anybody can understand. One virus is the same all the time. The other one, by definition, constantly mutates. That's why it's a misnomer. And everyone was afraid, like in HIV, so we can keep an open heart on the science part. But the reality today is we know a lot more. And then there's still a lot we don't know. And we understand there's something underlying. Why? There's a full group of researchers who are not on the race component, but on the science component, and say we can no longer get data about COVID. But we know so many things. There's such an uptake of so many dormant viruses. More Americans have broken femur bones. That's the strongest bone in your body. And long COVID, NIH has opened up an entire institute on long COVID, but you don't hear about it publicly. So when Jan says the racism, yes. BAI currently is attempting to empower the citizens of these yet United States so we can manage ourselves to wellness. We can no longer take everything the public health model says is a vitamin. And that's what Loretta Jones and her legacy ushered in, empowering citizens to be participatory in their wellness and in their health. And I think that's the huge opportunity that California has that many others don't. At BAI right now, we're collecting data. We had a meeting today with LA County Health Department. We can pull down everyone's surveillance report. And it's not about shaming people or even holding them accountable at this point. It's about us understanding the data as it relates to our people. And at BAI, we don't stutter. It's uniquely and unapologetically Black. The messenger matters, the outcomes matter, and the care and treatment. And that's what I'm hearing Jan say as well. But if we continue on this path, the world will believe that we're the sickest. And we're not. We're neglected. And primary health care has to be introduced in the conversation in a new way. And why do I say primary health care? It's like the threshold. And we are not educating physicians today in a way that they can see the diversity of American citizens. We can cascade viruses and say, why do Asian women have a disproportionate amount of ovarian cancer? Have we really looked at it? Why do Latinx people have the largest number of amputations with diabetes? Why do Black people go blind with diabetes? So I just wanted to pull it away from HIV and use what we call the morbidities, the sim morbidities. And if you come to maternal child health, the mother and the child, right? It starts, actually, the pregnancy starts before you get pregnant. And we rarely speak about that. That's why I say primary care. We rarely say in our communities, girl, you need to be prepared to get pregnant. You want to have that baby with this boy, make sure he ain't smoking them blunts every day. At BAI, yes, I said it. At BAI, we hold a whole session on all weed and now the new dispensaries y'all have with the green crosses. You know, I live in a place where there are no green crosses. So if in fact we're going to be well, it's a messy conversation. If we're going to be well and be Black and thrive in America, we have to own it uniquely and unapologetically for ourselves.
Parents, I'm gonna jump in.
Please, I want you to, please.
Tag me in. You done got me a new, good girlfriend. I could add. Let's add her to the Fierce Aunties Project, Jan. She's a fierce auntie for sure. I'm so excited because you said what most people don't want to talk about. They don't want to talk about their blunts and that new weed at all. But I've been observing it for over 10 years. But I won't get to that right now. I'll go back and you talked initiative and you asked about initiatives. So that was my point as a public health leader. So I'm actually here speaking for myself as a community member, but also then I speak on the other side as a longtime county employee with over 26 years in public health and health services, and prior to that being the first community health worker and first perinatal health educator, where I met Jan at the first Black Infant Health Program, which was Great Beginnings for Black Babies, Inglewood Healthy Moms and Babies. And at that time, we were coming out of, I mean, I guess we were still calling it endemic. It was a drug episode. We were dealing with crack cocaine then, right? And substance abuse. So alcoholism, drugs, as well as smoking, cigarette smoke. And so a lot of the impetus and information was still geared toward what we call victim blaming and shaming. And so coming into that work and looking at the high rates of Black infant mortality then as a student in college, in my last year of college, and being commandeered by, I call it commandeered by Delilah Crenshaw, who was a public health nurse, who I met during our first mobile testing when Centinela was creating their mobile testing unit. And she said, hey, I have this new project. I think you would be great to come over here and work with us. as our community health worker. And I was like, yeah, it's gonna get messy, Asa, as we go on. But at any rate, um, and I said, yeah, I'd love to do it. And so I looked at the data then, and we had these high rates of infant mortality. Then fast forward to 2017, and I'm like, okay, Center for Health Equity is being created in LA County, talking infant mortality. And I'm like, where are our numbers still? And we still have not reached a halfway point in LA County. So I felt as a public health leader, we were not doing what we could do in our community to really look at ways to resolve this issue. At the same time, I was working for Whole Person Care, which was a pilot project with Department of Health Services. And so one of my tasks was to create a community action team, and we were working on one of our high risk issues with maternal health. And I said, okay, let's design a community action team that's focused on African American infant and maternal mortality. Public health has the infant please health services to stay in maternal. But more importantly, right before then, my colleague here, my sister girl Jan, had been we have these different Sisters at Eight conversations, and reproductive justice are one of the focuses of one of the programs there was to look at reproductive health and justice. And we were seeing the high rates of maternal mortality for Black women go up across the nation. And they screened death by delivery, which was done by this young Indian sister who focused on Atlanta and New York and the high rates there. And so I said, okay, yes, we definitely have a case here in LA. And like you said, Grizel, we have the issue of people don't want to acknowledge the racism begins for Black folks pre-birth. When they get into, even before they get into their mom's womb, because the mom and dad or their parents, have created them. The mom and dad might have experienced racism their entire life. And then once our children are then birthed, and then we look at in 2020, CNN put out a article that says Black babies fare worse in the care of white doctors than they do in the care of Black doctors, racism being the issue. And in that article, it also stated that white babies didn't fare any worse in the care of Black doctors. And so that definitely had to be put to bear in that time. This was still 2020. But what we did when I came up and I went around to all my colleagues like Jan, Dr. Loretta was still alive, but I was talking to Falika, and I went to Yolanda Rogers Jones, who leads our LA County Black Infant Health Program. And I was introduced to Sonia Nyanga Dam of California Black Women's Health Project. And I went around to all the community, Win 1000 Grandmothers Pay. I didn't care what color you were. I said, are you interested? Because we're going to start this community action team. And we're going to bring to the community and say, hey, here are the rates. And what do we want to do? Do we want to do anything different? And so we had our first meeting in October 2018. Public health was very much on board. I was supported then while I was at Health Services, and went to see Kaiser and asked him to support us in hosting a meeting at the Baldwin Hills location. We had over 100 folks show up. We had to turn people away. And that was October of 2018. And all my goal was, and the goal of those that I partnered with in participating, that we would bring community and government together in a 50-50 partnership to look at ways to create interventions and strategies to reduce African American infant and maternal mortality in LA County. And then from there, and that was just in South LA, South Bay. We were just going to start, county is broken up into 8 service planning areas. We were going to start in SPA 1, which was Antelope Valley, 6 South LA, and 8 South Bay, because that's where the data was showing us. But as we started to delve further into the data, we realized wherever Black people reside, there is that issue. And as folks started to move around the county due to high rates of rent and all that other, we saw that now we see all the spas are impacted for the most part, and the lowest is SPA 5 because that's West LA. It's very costly to live over in West LA. So nevertheless, we saw that, but my other colleagues, Dr. Franklin, who's my director at MCAH, Helen O'Connor, who leads a portion of the AIM initiative, as well as our former Health Promotion Bureau Chief, Dr. Debbie Allen, they came together and they said, well, let's add on and create a steering committee. So they wanted to create a steering committee to look at countywide, bringing C-suite folks like Jan and other executive directors of organizations together to look at, to shape countywide, because on the groundswell, the CATs are going to look at interventions and strategies and work with those with lived experience, work with the pregnant and parenting moms, and create these projects and actions. And then the others are going to shape policy, shape where the county should be going. And we did that. But when we first started, we came together and said, how should these projects work? What is the community saying? So what we came up with, and I dropped it in the chat for our initiative, was from the steering committee side, was our shared values. Racism is the root cause. Black women and Black people have to be upfront in leading this initiative. We were going to be fostering equity while fighting inequity for Black women of all socioeconomic backgrounds, reproductive justice, anti-racism, and anti-implicit bias. And then also pieces of the puzzle. Everyone has a role. You don't have to have any letters behind your name to be a part of the AIM Prevention Initiative. No big eyes, little U's, that came from Falika. She was at one of the meetings. She said, I want to make sure we all are operating from the same space. Everybody's voice will be uplifted. Everybody's thought. We're also honoring professional, your intellectual property and time by stipending folks and things of that nature, and looking at ways to create other funding streams to support organizations that have been doing the work, those individuals that want to do the work, and expanding the Black birth worker pipeline as well. And finally, no blame game. Birth outcomes are a result of systemic issues, as my sisters have represented here, not individual women's choices. And that we had to really look at how we address that. And we were able to, and we're still doing it, bringing midwives to the conversation, the forefront, bringing doulas to the forefront, building conversation between the doulas and the hospital systems, so that they're able to go in and support their clients and also not be looked at as the enemy to the provider, to the physician, to the nurses. But we're a team all here working together to ensure that Black folks and Black women have a celebratory pregnancy and birthing. Why can't we have that? Why aren't those the same options afforded to us as anyone else? And so it's now a whole unit within AIM. We have a unit within MCAH, within the Department of Public Health, that is focused on African American infant and maternal mortality. And as you said, Grizel, our mindset is still the same. When we fix it for Black folks, we fix it for all. Because we're not just saying, when we work with policy like Jan and Black Women for Wellness and other partners, that Black Women for Wellness, with our current supervisor when she was Senator, Holly Mitchell, wrote the California Pregnancy, Dignity in Pregnancy and Childbirth Act. They also then turned around with other partners too and wrote SB 65, which is our first California Momnibus, which allows for us to even to have the guaranteed income pilot program, and also allow for doula services for anyone who's on Medi-Cal, if they so choose to have a doula that is covered from Medi-Cal. So saying that all to say that it just doesn't impact us, because like I said, everyone who wants to can access a doula. Now working with the health plans on the same, for them to start to offer doula services to their clients who are interested in it. And so we even have fatherhood engagement. We're doing a lot of different, right, to bring the dads in so we can demystify and stop telling the lie that Black men are not present. Black partners are not present in this scheme of things. Had somebody say something about the churches and then the family dynamics and the family structure of Black folks. Well, you know, if we want to talk reality and we want to go back to what happened when we were brought here, it was not for us to have a family structure at all.
Right. We're coming to the end. That is some exciting work, and you've got to come back and tell us more about that. I'm so excited about the work with the doulas. I didn't know the people with Medi-Cal could get doula services. That is incredible.
Incredible.
I believe Asa has a question, and I know that at 5 o'clock we have to end, but panelists, are you willing to stay on and continue the conversation?
Absolutely.
Asa, you had a question?
Yeah, thanks, Lance, and thanks for this. I can't believe it's already been 50 minutes. I've lost track of time. That's so great. And I'm just really floored by all the work you are doing. My question is, I think it was a point Jan brought up about the importance of the messenger delivering some of these messages to the community. And I was thinking about this recently, comparing RFK Jr.'s initiatives to, get people to eat healthier, although I'm not sure exactly what he means by that. But, the comparison of how people reacted to that versus when Michelle Obama was first lady and, introduced a campaign to fight childhood obesity. And that just seems like a really difficult problem to deal with because it's almost like the message doesn't matter. And that seems like a discrepancy that's rooted in racism of accepting the message from a white man, but not from a Black woman. And I'm wondering just thoughts on that and how to address it.
I can absolutely ask about, and here's the example I want to give to you. I hate to say his name even. Donald Trump ran against Hillary Clinton. And Hillary Clinton, on paper, was eons more qualified than that other person. Then he ran against Joe Biden. And Joe Biden squeaked by. And there were other people who had thrown their hat into the ring, including Vice President Kamala Harris, to run for that office. But this country thought that the only way that they could win that election was to run a white man. Third time Trump runs, he runs against a multiracial Black and Asian woman who on paper, who demonstrates absolutely more quality than that other person. This country has a problem with women, not just Black women. So, and it almost did not elect when there were two white men running. So it was like, who is winning the game of social media? Who is winning the game of the media? It is the messaging, absolutely. But when we look at the dynamics, or if we look at the breakdown of who voted for whom in this last election, what we know is that white men overwhelmingly voted for Donald Trump. And Donald Trump was able to increase the turnout of the folks who voted for him by talking to working class white people who actually voted against their own best interests. So absolutely, it is the messenger. Absolutely, if it's a white male messenger, it will be given the authority and respect due, as opposed to anyone else, but particularly a Black woman. We've seen that demonstrated in elections. We see it demonstrated in boardrooms where Black women say something and 2 seconds later, someone else says something. It was like it was never said.
Exactly.
So yeah, the messenger is critical. And this country, because of its steepness in the white patriarchy, the whiter, the more patriarch the messenger, the more people will listen, the more attention it will get.
That is the saying, Esa. My saying is the messenger matters, but we must all, this transcends race and class. America has demonstrated it is far more sexist than racist. So let's agree that's the reason why Obama won. because America demonstrated in that election that America, and this includes women, is far more sexist than racist. The next component part to that, though, excuse me, is is that we also have to deal with the permanence. People don't like to speak about this. The permanence of racism. Racism is permanent. Dr. Derek Bell demonstrated it. So when people ask me during the George Floyd era and beyond, I submit to everyone, read faces at the bottom of the well. That's the message that Jan is speaking about that won the election. And what do I mean? Racism is permanent. So if the majority culture believes that a white man can emerge from the street, the park, the drug addict, and put on his blue suit, he is better off than a black billionaire. Real talk. And that's why racism, from Derek Bell's perspective and research, and I am a student of it, believe the permanence of racism is there. So if we agree the permanence is there, how do we then surmount the problem? And I think that's where the opportunity is, specifically around maternal child health, Black infant mortality, period. Because in the area of sudden infant death syndrome, what we colloquially call SIDS, that's where you saw it the most, right? And NIH, we were able to, in a small way, and then go across on the reservations to the indigenous people, because culturally, their babies were dying because they were still engaged in what they call the mineral blanket wrap. Yet they had moved in homes, right? So now you wrap the baby in wool, and the house is like 80 degrees, and the baby sleeping on her stomach. You know, these were things that over time you were able to surmount. I only use that as an example because that requires a trust. We didn't use the word trust tonight at all. But people come to Jam because they trust them. I would submit to you, people join this messy conversation because they trust some part of it will be authentic. It may not meet everyone's needs, but we have to discuss trust from the consumer part of healthcare, right? Or wellness. That's why people don't stay in care. At BAI, we're currently working on a model that actually shows, and I believe it can be for anything, but obviously my example is going to be HIV. The biomedical interventions have occurred. We have all the science in the world. HIV is no longer a death sentence. However, people don't stay in care if their family nucleus doesn't show they care about them, if they don't believe the provider cares about them. Trust. We don't use the word, but in the wellness sense, if you don't trust the messenger, why would you be compliant? Why would you be retained in care?
Let's take a pause. David, would you like to give us our parting words and then we can resume our conversation?
Absolutely. Wow. Is my what a great conversation so far. If you need to leave at 5 o'clock, we hope to see you back next week when we'll be talking about work that's being done to make Antioch a charter for the NAACP. We hope to see you then. If you can hang out, we will continue the conversation a little less formally, perhaps, for another 10, 15 minutes. So I hand it back, Clarence.
I believe Jan, you were speaking?
If I was, I have forgotten the thought. I was responding to a comment that was in the chat. And the comment had to do with, are we becoming desensitized to the violence that we see perpetrated on Black folks in the media? And I'm talking about the real violence. I'm talking about how we watch George Floyd, and how we think about Breonna Taylor. But recently, there was a Black woman in Illinois who was shot and killed by police on camera, just viciously. And what has our response been?
And since you brought up this election and the new administration, the aim with the person who's going to be president is to militarize police departments and give them complete clemency. So, what does that look like going forward?
We don't know what the heck it looks like. And just imagine how we might feel, especially any of us who have family in the South. Here, it might be somewhat okay. But then, I mean, if we look at our map after the election, they got, when do we go from blue to maybe like shades of purple and red, especially Northern California started to look more red than ever. Certain spaces we go to, like, I wasn't surprised when I saw the march in Huntington Beach. I was like, oh, okay, well, you just come on out. And then it's the most hilarious thing to come out to um, Ice Cube. I think it was Ice Cube and Dr. Dre's music and marching in the streets. And I'm thinking, wow, this is just so special to me. um to note that and to think about again, yet again. I'll then have to revisit what my deceased mother felt for her sons, and in the same mindset of my nephews, in the same mindset of my brothers who are most are in the South, in the same mindset of my cousins, and even my daughter who's in the South with her children. Is it safe, or should you bring yourself back on over on this side for 4 years? Because who knows, or do we start to make our exodus? I looked at, I wish we had one sound, right, as a people, as human beings. I looked at the sister, and I don't know her name exactly, from the Maori people in New Zealand that did the, I want to say, am I saying it right?
The hockey,
Yes. And when I
that
said,
was so powerful.
absolutely amazing, because all of the people of that tribe and that community that were present, from on the floor to in the seats, responded in unison. And people are like, oh, they're just doing a chant, like that's what people think. But and it reminds me of Sonia Massey. She said, I rebuke you in the name of Jesus. She didn't say anything other than what you know in your culture as a believer of Christ that goes to church, or maybe was raised in a church. She said, when he said, I'll do XYZ to you, she said, I rebuke that. That wasn't uncommon. Jesus rebuked folks. People in the church rebuked folks. But that's what that Haka reminded me of. But the rest of the people got in unity with her in opposition to, yet again, the stealing of the land and not being clear and wanting us to vote on something. And this is what happens. And so, not sure, because then I looked at something that said people had the nerve to Google, could they change their vote? Could they change their vote after the election is all over, after they've submitted a vote? Clearly, people don't know anything about uh, U.S. government, politics, or anything
Or
else.
democracy.
The
Yeah.
deed is done, baby.
I just want to also add to that in California, we absolutely do have reason to be concerned about police and the militarization of police. And this whole law and order regime that has come into be, because California, oh my gosh, they rejected or they accepted Prop 36, which will roll back Prop 47 and all the resources that was going toward mental health and rehabilitation. So in addition to Prop 36, they also voted California to, with Prop 6, to continue involuntary servitude, i.e. slavery in California. And with that, they ousted Gascon and the progressive public, what is it, DA in San Francisco also. So electing a very conservative DA. So California voters were like, real scary. And with that, because we have international events that are coming to Los Angeles in specific and California in particular, we also have set ourselves up for our police force to be federalized. Mhm. And I should say also that the new police chief, the highly paid police chief in Los Angeles, has been known to have relationship with ICE. So we have lots to be concerned about in California and in Los Angeles in terms of, will this become a military state? And how do we deal with this law and order regime that has come into power and that we put there? And we put there because we didn't have control of the media, and we didn't have the resources to do the education that was needed for critical thinking among the electorate.
I see Lisa Munoz has her hand up, has had it up for a while. Lisa, you want in on the conversation?
Hi, yes, thank you. It was me that put in the conversation in chat about desensitization, and I'm questioning and wondering if it is just about desensitization, or is it the empowerment of white supremacy? And I bring that up because during Trump's first occupation of the White House, we had Charlottesville, and they marched without hoods. They marched with their torches. We see what's going on in Palestine. To me, that's racism. What's happening? To me, the Zionist government of Israel is white supremacy. So is the whole world not just what's happening in the United States? Is it truly merely that we're desensitized, or is this the product of an ideology of supremacy that we see that's coming into power? And I question this, because if it is truly just about desensitization, what does that mean about hope? What does that mean about the next 4 years that we are going to encounter? I am Mexican American, and I too am concerned about deportation. I'm concerned that I can be stopped at any given time and asked to show proof of citizenship. So is that along the lines of desensitization, or is that white supremacy? I look at the demographics of who voted for Trump. Latinos voted for Trump. Latinos who somewhat believe that they're quote unquote white. What is that about? If it's not about white supremacy, if that's not about racism of coming from my race, misogynistic, yes, but when it comes down to it, it's racism. So how do we combat this? If it's desensitization, that means we are a country that is not feeling on any level. How do we get that back? How do we create a society that understands racism at its core? And to be quite honest, it somewhat scares the heck out of me to believe that we are now living in those types of conditions. So that is why I posed it, because I'm grappling with that, with those contradictions. I'm grappling with, how do we maintain our humanity, and how do we go forward in creating a form of humanitarianism that is just not centered in the United States, because God knows that we need to go worldwide. This is international. We are all over the place. Black, brown, we are all over the place. So how do we as a people engage in this, moving forward in this dialogue? Yeah, and I agree with you, Jeanette, with your response. Yes, it was horrific that she was killed point blank, but she wasn't the first. And why does this keep happening? What are we doing that's not fixing the system? And with this new administration, with how they're coordinating the educational system, how they are wiping out critical race theory, how they are now going to attack universities that have affirmative action in place, and they are going to now go for reverse racism. And Trump has said he's going to go after these universities' endowments in order for them to stop reverse racism. So this is an empowerment for me. It's a direct empowerment of what supremacy looks like.
Yes, I'll say real quick and then pass to my colleagues. Here's the problem that happened, in my opinion and estimation, and I'm not the only one that thinks this, a lot of people do, is that when Biden won the election, excuse me, against
You
Trump,
okay? You need me to jump in?
I'm gonna pass it to you real quick. Against Trump, in what was that, 2019? Folks immediately went into, we saw Trump 2024 signs. And we passed it off like impossible, right? They went into action. They had already been going into action when he first would, and we should have known on January 6th, when they wanted to act like that did not happen, act like everybody didn't see this type of insurrection, act like he wasn't involved, didn't, all the parties that participated didn't get any penalty, even though generally, if you have any type of connection via text, email, whatever, you could be held liable, right? Because it's called conspiracy to conduct whatever felony or crime. Didn't happen. But what we didn't do was just get as strategic as they did. They put it out there, they let us know we're coming back for it. And we thought, what a joke. Impossible. Not gonna happen. And then we knew, like, this America, after the courts and all of that and the felonies, people aren't gonna do that. Well, guess what? They did. And Jan, I'll pass it to you. You could carry that one further. You or Griselle, if you like. While I grab some water.
Where are you going to go, Jan? Griselle?
At the clock.
Jan
Wanna-
muted. Oh, Jan, you going, Jan? Or shall I say, oh, she don't want to touch it. Look, it's a hot potato. I'm new on the scene. Let me just stay messy and dirty with it. Here's the reality. We must talk truth to ourselves. As a third generation Northerner, as a woman who happens to be Black in these yet United States, shame on us. Shame on us. I'm of the group that benefited from the dogs and the water holes and all of that. I'm that group. We've been holding our fingers on the dike. We've lost affirmative action. Civics isn't taught. Lisa said it. We haven't stood in solidarity in the right way with the genocide in Palestine. We haven't. We taught the world how to advocate. We taught the world civil disobedience. We taught the world advocacy. And we act like we knew on the scene. We've seen some of this before, but some of us haven't. Earlier today, I'm in Atlanta. I think he's nationally syndicated. Big Tigger and I, if you know Rap and Rap City and 106 and Park, we spoke this morning. I had the privilege to be on the tail end of free love and sex. So I know a world without HIV. There's some youngs who do not know a world without HIV. I remember where it was free love and then, oh, no love, no glove, no glove, no love. What? I mean, I've lived a charmed life. I'm a member of sorority all day, every day. Right? Talented 10th, whatever. At best, I'm a slug. They say I live in the South. New York is a snobby. Nobody that's an achiever moves from the North to the South. Fair? The reality is this. We must speak truth interracially as well. David is real messy now. Lisa is real messy. Why? Because I say to all my Latina sisters and Latinx brothers, hey, immigration ain't Latin. Immigration not Spanish. Have you been to an immigration meeting where you have Haitians, where you have Jamaicans, where you have West Africans? No. I live in Charlotte, North Carolina. Outside of California and Texas, we had the largest population of Latinx. The woman that cuts my hair, her neighbor was picked up. They called him deportation Obama, y'all. He actually deported more people than Trump probably could have the opportunity to do. So the party system is broken. The Democratic Party doesn't deserve us. But do we deserve to opt out? No. So you get on all these calls, just for the record, Win with Women been around a decade, but most Black women just found it out in the last 100 days. We are not carrying our own water. We are not holding persons accountable. The Republican Party gave you Condoleezza Rice. Biden and them never consulted with her on the Ukraine. PEPFAR exists because a Black woman said to the president, Bush, your legacy will be nothing if you let people die of HIV. We're always in a space of influence, but we've gotten comfortable. You earlier said, Jan, people don't know the law. It's civics. Right now in this country, 1 in every 3 persons in construction are Latin. In the North Carolina, we have no Black children in shop for construction. $1 trillion business. But we don't have any women, Black women, on what? The PTA. You can't be of a system and victimized by it if you're not in it. We have, well, in many ways, we have been mortgaged out. And we let the Clintons do something that was dishonorable. And what is that? Everybody's not middle class, y'all. There's some brilliant, proud, working class people. The Clintons took their working class word out. So now we got people living in false fantasies. They never were middle class. That's how you get some of this hatred and disproportionate sense of I'm at the bottom of the well. You want to know a place where they really are managing fascism? Germany. Why? The atrocities. I was in Dachau. They still have Nazis trying to come and get Hitler's artifacts and these things, but they are so committed to not returning to that. Where in these yet United States, we trying to uplift it. And you know, I talked about Derek Bell, but hey, you cannot leave out Langston Hughes. Sometimes you get pearls, but you have to have the agitation. These 4 years may be for all of us. Langston Hughes said it best in The Ways of White Folks. Give them what they want. Give them what they want. I never thought, being in New York, I say this to everyone, all New Yorkers are Jewish. I never thought in my lifetime I would see Jewish people standing with Palestinian people saying it's wrong. So sometimes you have to give them what they want, because there's many Jewish people who know there's genocide, but they can't remove Netanyahu. Trump told y'all if we vote for him this time, there'll be no more elections. Those are the verbatim words of Adolf Hitler. But if you don't read, you don't know, right? So we'll see. You must give them what they want. I think fear, the crying, and the despair is not where we need to be. It's a wasted place. Remember who we are. We're the people who showed people civil disobedience. We are the ones who ushered in suffrage. Women's suffrage, white women didn't get to vote on their own. How did Asian people get an anti-lynching? Really? It still frosts me, Miss Jones. I am really frosted. My armpits burn. How did Asian people get anti-lynching and lynch is still on the books in many places? How is so? Because we got cozy. It's a messy conversation. And I'll say this is my last comment. At the Black AIDS Institute and in my real sexy life work, we trying to assemble us to get back to us intra-racially. Can't move out and hold others responsible until we have a program. Our women are the most homophobic on the planet right now. And that's incongruous with doulas. How do we bring life and we have so much judgment and disdain and hate in life? Black women. How do our young men increasingly 12%, 19%, now 22% of the black men eligible to vote in this country voted for Donald Trump because they say, I don't want a woman in the White House. How is this so? How do we deal with that intra-racially? Lisa says Latino men did vote, but in their culture, the machismo is there. And I know the great Latin women I know, they know how to massage it and still get it right. How do we? We're not immigrants. The Africans that come to this country are immigrants and they were colonized. We were enslaved. We had to break out of it. We weren't ushered out. So how do we get to this? We must speak truth to ourselves. We too busy trying to get a bigger car and a bigger house. And that's all whitewashed. So we missing the boat. We haven't held the Democratic Party responsible. No, those are the conversations that have to be had. And my theory about them is black people all need to get in the room and tell truth to themselves first. Then we can come back to these yet United States and have a real conversation. We have now been the shadow of being locked up. This is still a capitalist country. Somebody got to be at the bottom. Y'all may not invite me again, but if you do, I'd like you to know I think this is the most interesting panel I've been on in a long time. It is wonderful to be surrounded by courageous people. And so, Coretta Scott King, being an alumnus and of Antioch, and Dr. Maxine Mims, who was elated that Clarence was associated with Antioch, and the village, as we call ourselves, I just represent a real small part of it. I will go back to our village and say, there is a place where there are courageous people who are still having hoity conversations, relevant conversation. And I thank y'all for having me. And I look forward to getting to know you better and for us to do some real good black girl trouble work right now. I wake up every morning thinking we can change the world, so let's get it.
Yeah, we better get with it.
Mhm.
Somebody's gonna be left behind.
Dr. Gills, I hope you heard what Griselle Howard said.
I very much so did.
I'll give you all her information so we can commandeer her.
For sure. For
I'm
sure.
already on it.
Thank you so much. And thank you all who are in the scenes and asking the questions and making the comments. It is not just, we just can't make it incumbent on one group to solve this. that we all have to be the collective body. It'd be wonderful if we could just be human and racism wasn't a factor based upon race and the color of folks' skin. But that's not where we sit. And this is where we now have to sit with the outcome of folks' decisions. Um, Often we find not based upon just humanity, just based upon greed, based upon ill taught information, based upon not having an experience with people. Oftentimes, Black folks hadn't even thought about or don't really get to. I mean, I'm saying not. I can't say all Black folks aren't racist or don't have some racist issues, but generally we were taught to treat people based upon how they treat us, right? What our experience with them will be individually. And so that has worked for me. Now, I will tell you, after the 5th, I have yet been reminded. I thought about it a few years ago when I heard a young sister saying she had to go back. This was after when Trump, um, what was that man's name that he elected the judge to the Supreme Court that they were
Kavanaugh.
yeah. And this young sister, we were at a breastfeeding conference, and she said, "Now I have to go back and help my white sister friends and colleagues feel better after this situation." And I said, "No, you shall not," because this was right after not long after we saw the data on how folks voted. And I said, "Why would you do that?" Because people will show up in your face one way and then behind your back, they're doing another thing. That's not your responsibility to go and absolve. They should have their own conversations about how they keep voting against their own bodily autonomy. How we don't create policy. And gentlemen, you might not like this, but I'm going to say it. How we don't create policy over men's bodies. I dare say the conversation would be different if we didn't just allow Roe v. Wade to be overturned without us then turning around and saying, if in fact you got someone pregnant through, I don't even want to say unprotected sex, but you got someone pregnant, you are just as responsible as that individual. So if a woman then shows up with a stillbirth and she needs to have a D&C, we don't want hospital systems or providers to think, no, I can't help her because she had an abortion, or having people think that that's what people are doing, running down at 9 months. I had a Black man stop at campaign headquarters and say, I can't support them because they allow women to come in at 9 months and have an abortion. I said, that's a damn lie. Stop listening to foolishness and understand the truth of what's happening. But even that, the young sister who had a miscarriage in Ohio and then was penalized, couldn't get help first and finally deal with the fact that she experienced loss. Instead, she had to go to jail and then figure out how to get herself out of a situation from a miscarriage. And this was happening prior to these folks coming to office, and it's going to most likely get worse. And so, when are men going to be held responsible? There ain't nobody getting pregnant on their own.
Or just disband after prostate cancer, or ban the Da Vinci surgery and they getting the pump. I started out earlier being messy. I said the number one spend in research and money is prostate cancer. The joystick gets the attention.
Let's get messier, okay? I saw a post, and I forget who said it, but it goes something like this. If it is God's will for a woman to get pregnant, then it must be God's will for a man to go and suffer through erectile dysfunction. So Viagra should not be needed. And I thought, wow, this getting deep around here. Folks is cutting deep. And I mean, come on, let's just talk it through here on both sides. It's only fair. It's only fair, folks.
I hope y'all can see.
Where are you? I can see you.
I don't know if
I
you can
think
see.
you have to add faith to this at another time, see.
I was just going to say, I hope y'all can see how much love you're getting all over the screen in the comments. I am conscious of your generosity with your time as we're coming up on 5:30. As you've been talking, I've had so many thoughts, but one of them has been, how can we get these three back every week? That's one of my thoughts. I was so appreciative of your time, your generosity, your wisdom, the work that you're doing, and your willingness to be here with us. Thank you, Clarence, as well for organizing all of this. A reminder to come back next week for a messy conversation with Pia and Stephanie from the Antioch community about NAACP charter here at Antioch. And show more love to these fine people.
Yes, and Jan just put her podcast information in. So let's check that out for sure, for sure. Thank you, ladies. I'll be in touch with each of you individually for sure.
Thank you so much, David, Clarence, the entire Antioch team, Asa, Dr. Elaine, and Cian, Christine.